Hello and welcome to Medical Dialogues, your daily dose of health and medical news, and I am Dr. Nandita Mohan. Weight fluctuations increase cardiovascular and mortality risk in type 2 diabetes patients. A new study that has been published in the Journal of American Medical Association found that higher variability of adiposity was related to a substantially increased risk of cardiovascular disease events and even mortality in people with type 2 diabetes, meaning that increased fat accumulation in the body is very closely related to cardiovascular disease occurrence. However, the study also mentioned that higher variability of obesity was independently associated with increased risks of all-cause mortality. Statins' role in lowering cholesterol, a new set of guidelines released. Given the expansive contemporary role of statins for primary cardiovascular prevention, the guidelines drafted in the Journal of American College of Cardiology talks about 10 take-home messages to reduce the risk of atherosclerotic cardiovascular disease through cholesterol management. The AHA-ACC Multi-Society Guideline makes an important contribution in changing the perspective of treatment for a patient in a more personalized way. Particulate matter air pollution affects the semen quality and fertility in men of reproductive age. According to an article published in the Journal of American Medical Association, air pollution has been reported to affect the semen quality, specifically the sperm motility, the ability of the sperm to swim in the right direction. In conclusion, the effects of particulate air pollution on the sperm quality, particularly the motility of the sperm during spermatogenesis, underlines the need to limit the ambient particulate air pollution exposure in reproductive aged males. Going gluten-free? Consult your doctor before following. Gluten is a protein found in many foods like wheat, rye, and barley. Doctors say that people with gluten intolerance can develop symptoms such as bloating and abdominal pain on consuming food that contains the protein. Now, the effect we all know is short-term. However, if a person suffers from celiac disease, consumption of food items that contains gluten leads to an autoimmune response that can do long-term harm. Such patients often present with recurrent diarrhea, failure to gain weight, weakness, anemia, irritability, and behavioral issues, among others. However, strict avoidance of food that contains gluten helps improve them all. Dr. Prateek Sharma, the MD Gastroenterology, Professor of Medicine at the University of Kansas School of Medicine, mentions that there is no cure for celiac disease. Avoiding food containing gluten remains the cornerstone of disease management. He, however, added people who have not been diagnosed with celiac disease shouldn't avoid food containing gluten just because others are doing so. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.